Good morning, Nurse.org. How y'all doing? As you know, my name is Mphatso, aka Zulu Nurse, and I'm going to be with y'all for the next 24 hours talking all things trauma nursing. And now as I embark on new territory, travel nursing, and I'm traveling as a trauma. I'm actually doing my stroke scale as we speak. If you know, you know. So I'm halfway through. So when we finish up, I'm going to come back and we're going to get to chatting. Looking forward to your questions. Drop your questions below. In regards to if there's anything you want to know about traveling or my assignment coming up, and also trauma nursing. So a little bit about me. I am from the great city of Atlanta. Debate your mama, not me. I am a trauma ICU nurse, but I started off as a LPN on a general med-surg floor in Huntsville, Alabama. Then I got my RN, became a cardiac nurse at one of the hospitals here in Atlanta. Then I was ready for something a little bit more challenging, so I went to a level 1 hospital, also located here in Atlanta, where I became a trauma nurse. And I've been a nurse since 2018. So here's why I decided to become a trauma nurse. And I'm going to put a link in this story that y'all can go to check out how to be a trauma nurse that was created by Nurse.org. So y'all can get some more resources for those interested wanting to be a trauma nurse. So as stated previously, I worked in a cardiac PCCU floor. We dealt with a lot of sick patients cardiac wise. So we dealt with a lot of cardizem, cardine, amio, nitro drips, those kind of medications. But they weren't intubated. So if they needed a higher level of care, if they needed levo, then they would go to the ICU. So it was what you would call maybe a step down. And on that unit, I was doing precepting and, helping out with workshops and helping run code blues. And I liked it, but I wanted more of a challenge. I wanted to deal with even the sicker patients, which is what led me to trauma ICU. And let me tell y'all, if you want to bamba, if you want to chill with the big boys, go to a trauma ICU, because that will change your whole perspective about nursing. If you want a challenge, if you want to be able to learn and really kind of just experience just a different specialty, trauma will definitely be that. It would definitely be that. Let's spend a 12-hour shift together. Let's go. So after clocking in, I get report from the night shift nurse. So this shift came in swinging because as I was doing my assessment, I noticed a neuro change and I had to get a stat CT. As you can see the stress on my face. After stat CT, I'm going and looking at orders, checking on my other patient because I wasn't even able to look at them, had to get down there so fast. My friend saw I was stressed, so she brought me some Starbucks. Now I'm starting to do some charting, trying to catch up on everything. And I'm finally able to take a bite of something to eat and drink a little bit of coffee because I've just been on the go since I got in the door. Now it's mid-shift. I noticed my patient had impeded, so I realized, time to put a Foley in. My student nurse did an excellent job. Now I'm getting labs. I want to take a moment just to shout out this scrub that I'm wearing by Uniform Advantage. It's their Butter Soft line, and I absolutely love it. It does an excellent job at tummy control. It has this cute little cross pattern on the shoulders, and it's super comfortable, and it makes 12 hours feel like a cakewalk. Now I am doing more charting and trying to catch up because it's just been a lot of running around and multiple tasks. Finally able to break away to get me a little snack from the vending machine and passing more meds, these antibiotics. Awesome question. What made me choose trauma versus other ICUs? Well, considering that I love cardiac, I felt like trauma was going to give me the challenge that I was looking for. It was going to give me the critical thinking that I really wanted. Do I see myself being a trauma ICU nurse for the next few years? Yes, because I feel like I'm just barely scratching the surface and I really want to get the full exposure and also want to get my TCRN, which is certification for trauma nurses. So I just want to learn. I knew trauma ICU was for me because I envision myself doing it, you know? And you got to have a certain level of self-awareness. I know I can't be a psych nurse. I don't care how much money they're making. So you just got to know yourself. You do see a lot of crazy things as trauma nurses, and tune into my live tonight and I'll go more in depth on that because I had to learn how to cope. So some of the ways that I detach is I give myself permission to cry. My steering wheel's seen a lot of my tears. I talk to my other nurse friends, and I have a therapist. Well, y'all, that is it for me. I've had an amazing day with you guys. Thank you for all those who supported and shared, engaged and asked questions. And also just want to say a big thank you to Nurse.org for this opportunity, for allowing me to come on your platform and trusting me with your followers. I greatly do appreciate it. And y'all really do give Nurse.org look at their resources. They have a lot of things that help nurses and nursing students, as well, articles that can just make life a little bit easier because our life is already complicated enough as nurses. So y'all check them out, and until next time, good night.